Hello, dear friends. I am Dr. Banshi Saboo, along with me, Dr. Amit from New Delhi, Noida. We are here at ATTD, world famous Congress on Technology in Diabetes, from Florence, Italy. This meeting attracts all those who are interested in field of diabetes technology from all over the world. This year we have more than 5,000 attendees from all over the world. It is not only doctors, diabetologists, educator, but many more who are in field of diabetes technology like engineers and even the researcher or scientist. On second day of this meeting, very interesting session today morning was on artificial intelligence in diabetes. We know that we are talking for artificial intelligence in many fields, and AI in diabetes is an upcoming field. But it was to my surprise when the speaker was talking that if you just write AI in diabetes in Google, you will find thousands of hits in Google. So you can understand that how many people in the world are really interested in AI in diabetes. And I would like to ask Amit. He is, that a upcoming technocrat of India who is highly techno friendly and doing a lot of work in field of diabetes and in technology. So would like to ask Amit that where you can see the scope of AI in diabetes, in particular for Asian countries and from India.
Thank you, Dr. Bansi sir, and for giving this very nice and kind introduction. And we all know that Bansi sir has done a lot of work in the field of diabetes technology, and it is really very kind of him to say such nice words for me. As you have seen in last 2 days, we are witnessing a revolution in form of technology, whether it is automated insulin delivery, whether it is glucose sensing technologies, and now we have seen that a lot of things they are happening in the field of these are backed up by the AI as well. So today also in his address, Dr. Stephen Del Patro, he said that AI is going to come anyway, and it is now up to us that how we are going to structure this AI so that we can use it in a positive way so that it can benefit our patients. So I think AI is going to take over diabetes management, and he has shown a slide. I think you have also witnessed that slide where he has shown that the AI driven diabetes management was as good as management of diabetes by a diabetologist. We have come to such an extent that where we are talking that AI versus diabetologist based management. So I think AI is going to be a very important part of our life
Very
in
true.
diabetes
One more
management.
slide which they had shown, there is a significant gap between the academic results and real world implementation.
Yes.
And there they are also saying that if artificial intelligence will work, we can see that whatever the promising academic results which we are seeing, how they can be transformed in real world also. So,
Yes.
the AI will also help us that whatever the results which we are seeing in academic results, they can be also translated in our real world. The current position for many of our diabetologists, they feel that handling of technology in practicing is real cumbersome. So what is your thought on this, that from India perspective, that even we run a diabetes technology meeting in our country, even ATTD is thinking going for Asia meeting. So where you think that really you feel that diabetes technology uses by a diabetologist or physician is really they feel that they should not use it, or if they feel it's cumbersome?
I think there are multiple challenges which are there when it comes to diabetes, uses of diabetes technology. For example, number one is that there are so many patients a doctor has to see in a day. So uses of technology requires some degree of involvement and some degree of engagement, as well as some time when you utilize all these tools. But at the same time, if we are using technology, we are able to improve the quality of care as well as the standard of care. This has been shown in multiple studies and multiple modalities also. So I see in one of the slides, Dr. Stephen has shown that diabetes management is equal to data management. So now we have data, whether it is regarding the diagnosis, screening, prevention of the complications. So data is going to be the gold mine for the diabetes management in the future. And so here we are discussing AI in
So I
diabetes
mean,
technology.
I very rightly you are saying that data management is equivalent to diabetes management, and that is what the same is being discussed. So the artificial intelligence may be a solution for this data to be managed,
Yes.
and probably then the time constrained by the Indian physicians or those who are very busy practitioners, I think the artificial intelligence will work in their day-to-day clinical practice, and they will able to accept the newer technology in their
So
practice also.
artificial intelligence is going to make our task easier, but again we need to identify the right kind of technology, approved technology, as rightly pointed out by Dr. Tade again, that we cannot use Chat GPT as it is. It cannot be applied to the medical subject like diabetes or any other conditions as it is. There has to be a certified application of Chat GPT or any other AI driven platform which is tested, approved and certified for the use in medical field.
So, do you think that AI in diabetes will give them clinical decision support also?
Yes, I think you have also highlighted at multiple points that diabetes is not a single disease. In fact, it is a cluster of multiple presentations or multiple diseases. Right now, we don't know which patient of ours is going to develop retinopathy, which patient is going to develop cardiac complications, which is going to develop kidney complications first. But in future, based on AI prediction models, we may be able to identify those patients which are more likely to develop any complications based on this predictive analysis, and probably we can do more intensive follow-up, more intensive care in
So,
those.
my paper, which was we had here done, and I was the first author for that, the 221 type 1 diabetic patients to whom we have put the 780Z,
Yes,
and the two groups, adults and pediatric. And the pediatric group, we are thinking they will be surviving for 50 years more, and the adult will be having for another 25 years. And predictive analysis for their complication. If they keep on their HbA1c around 8.5, instead of that, if they are given a 780G advanced hybrid closed loop system pump, probably the complications, which will be for neuropathy, retinopathy, microvascular complication, all will be very, very significantly reduced in the people who are put on AID
yes.
in compared to those. So that's what predictive analysis will also help our clinician, that yes, this therapy is going to give them a benefit, and it will also give them a pattern how their patients are doing, and it will also give them, as you are rightly saying, the clinical decision support. It will also help for them.
Since you talked about the AID, yesterday, if you remember, there was a presentation in the one of the plenary sessions, and there they have shown that though we have achieved AID, and almost 90% control is there, more than 98% of the time you are in range, but still some kind of input is required. You need to announce that you are going to do exercise, you are going to take a meal, and only then the system works. But now they have shown that with the help of the neural network and the development of the naplings, or the napping, what they call development of the neural network, now in future AIDs will be powered enough that this announcement will not be required.
So it will be
So
a
this is
complete
how,
artificial
so
pancreas.
artificial pancreas backed by AI. So this is what we have
So
seen.
you don't have
And
to feed the glucose, food, physical activity,
yes,
nothing, and it will take
and
on its
let me
own.
ask you one thing. You have also seen the sensor which one of the company is bringing, and it is a predictive
Yes.
smart predict technology, which is again backed up by the AI. So
So
what
the
is your thought on
continuous
that?
glucose monitoring, which is coming in future, what we are having real time, but a time had come that now this sensor is going to show you the predictive glucose value, that what is going to happen after 1 hour or 2 hours, and that's very, very important for people with diabetes, because predictive sugar report will prevent them for getting them hypoglycemia. So it will
Right.
almost like 100% you can say that patient will not go in hypoglycemia, and it is also alarm system also. So even though you can put it like below 80, it is going to give you the alarm that yes, the person will not go in hypoglycemia. So that's what the future
So
is.
I think this is very, very exciting, and so I think you can sum up this AI part of this technology
So
driven
what
diabetes
we
care.
are seeing at this point of time, I can say it's like tip of iceberg. The uses of AI in health and AI in diabetes, what we are seeing is only a tip of iceberg. Probably we will have many more things. Medical professional aspect is to be considered more adequately, not only become economics one, interaction with other players in the field, and safety aspect has to be considered, but no blocking by this. We all are on the way, and European Association, they have, the ESD have a dedicated a forum and
Working
which
group
they are
they have.
working group also, and they are supporting the AI in field of diabetes. So that is what we can also think from India, and I'm sure in India we will able to make also a working group in our country on AI in field of
Yes,
diabetes at least.
yes.
There is a guidelines ATTD is looking for, that AI, as you are saying, that it should be endorsed, or it should be like, as you said, the chat GPT cannot be used in the same way unless it is proved. So similarly, there was one very interesting paper by Tade which he has talked about, that even a detection of diabetic patients with a person with normal glucose value using the machine learning, and they have done for more than 60,000 individuals with normal
Yes,
fasting value. So the sugar for all these people were normal, but still with the help of artificial intelligence, they could predict that who will become diabetic
right.
in near future. And this paper was published, and that was really very interesting because it was published in British Medical Journal in 2023. They
Yes,
also talked about a machine learning in a predictive diabetes care with a cardiovascular risk prediction. So I
right.
mean, those with diabetes, even then it can predict that who will develop the cardiovascular disease in future. So these are the some of the very interesting papers which was published in ATTD, and Dr. Tare had talked about it.
And just today you have yourself witnessed that how easy was it for you, just by screening your fingernail. The technology there was able to tell you that whether you falls into a low risk category or a
High
high
risk
risk
category
category of developing diabetes. So such kind of technologies
is
they are
available,
also
and probably
available.
it will become a point of care testing for
Yes,
mass detection, that who are
and
at the risk of developing diabetes,
and
and
if
then they can go for this
and there
screening.
was another interesting paper which was flashed by Dr. Tade Batilino, and he showed a meta-analysis for diabetes prevention, use of digital therapeutics in diabetes prevention. And Dr. Stephen showed a photo from the ESD where he was standing with Dr. Peter Schwartz.
Ah,
So you know that you are very close to Dr. Peter Schwartz, and you are also the chair-elect of IDF Southeast Asia. And one of the mission of Dr. Peter and you is that everyone with everyone in this world must be having an app for diabetes,
exactly.
which can lead to diabetes prevention. So I think,
And that is what we are doing in
yes,
India also, World Congress of Prevention of Diabetes.
yes.
Again with the Yako and with Peter Schwartz. So this was very interesting session in artificial intelligence in field of diabetes. Then we can talk about something, anything more interesting. Do you want?
So I think there are a couple of more things. If we like to say that in previous session versions of the ATTD in the previous years, technology was discussed, and most of the discussion was happening around the type 1 space. Now this year, what change you have witnessed in the
So
ATTD?
one very important thing that many things have come, new therapy, and as you know that newer therapy had come with the diabetes and obesity. A lot of discussion was there for that, and at the same time even uses of technology in type 2 diabetes. So we are going to have even a using continuous glucose monitoring for type 2, even a guideline for using CGM for type 2 diabetes also. And these were some of the papers which was talking about the like SGLT2 inhibitor in the patients with hospitalization for heart failure, or a patients who are with GLP-1 receptor agonist, some registry, even in a DPV registry where the type 1 diabetic patients were put on a GLP-1 and SGLT2. Now, if I see the Indian perspective of it, we don't get so many obese type 1. Maybe one of the reason is they are mostly uncontrolled diabetic. As you know that our type 1 diabetes, the level of control is more than 8.5 average, and that's the reason they don't gain the weight. While in Western population, there is a challenge of managing type 1 diabetes with weight problem, and they started using even a GLP-1 and SGLT2. It was off label, but now many papers were there that using GLP-1 and SGLT2 inhibitor in type 1 diabetes, and that was very interesting paper. And Viral was talking only a dedicated talk on
Yes.
this also. So you must have heard about it.
So I think this is really a major shift, that now we are talking about use of diabetes technology, use of including AID as well as CGM in type 2 diabetes. And let me congratulate you that you have been a part of new consensus statement which is going to come soon for the use of CGM in type 2 diabetes by ATTD. And also we have seen that now some drugs like GLP-1 and SGLT2 inhibitors, they are also going to find some space in type 1 diabetes therapeutics as well, as more and more evidence is gathering. I
Yes,
think
yes.
in
So
near future
maybe in
we are
near
going
future
to,
it will become the.
so it again gives a rise, gives a ray of hope to many of those people who are living with type 1 diabetes.
Very true. There were papers also for once in a week insulin,
Once
as
in a
we
week
know that
insulin.
there are two companies who had come already, and data is published that once in a week. Where you think that once in a week insulin will be useful for type 2 and type 1 diabetes?
I think once in a week insulin is now talk of the town. Many people they are talking about it. The data suggests that it is at least as efficacious as once daily glargine therapy, and you know that so once weekly therapy is going to reduce the burden of insulin injections. So number one, the cost, the number of injection comes down, so the compliance increases. At the same time, when the compliance increases, it is definitely going to have a better HbA1c control. Also, people with type 1 diabetes, though it is not yet studied in that space, but in future maybe the long acting
So at
glargine
least in future, for type 1
once weekly.
diabetic patients, once in a week, if you give someone basal insulin, the risk of diabetic ketoacidosis will significantly reduce.
Yes, this will
Yes,
also reduce.
definitely the bolus shots they have to take continuously.
Yes,
And for type 2 diabetic patient, for initiating them on a once in a week will be very easy. Even now, the data is going on with a once in a week GLP-1 in combination with once in a week this insulin also. So future will be there with once in a week injection. You are giving GLP-1 and basal both, because in type 2 diabetic, first to initiate these patients on therapy, either GLP-1 or with basal, or mostly it should be in combination. So I think future of therapy or titrating the patients with uncontrolled diabetes on oral anti-diabetic agents will be a future with once in a week injectable GLP-1 with once in a week injectable basal insulin for that.
so I would like to ask you the last question. So which new technology you feel you have seen in the exhibition, or you feel that it is going to make some
So one,
major
I
impact?
will say the existing technology, the continuous glucose monitoring is the future. I heard one person very strongly, he was talking today morning in a session, that if even if a type 2 diabetic patient, the first thing I will do the CGM,
Yes,
the second is GLP-1, and the third I will put the patient on SGLT2. So you know how the paradigm is getting completely shift. I mean, the monitoring is become more important than putting the patients on a therapy. So that's
right.
number one. So that I will say that CGM for next 5 years or 10 years, maybe in our country also, it will become number one.
And I remember that he used the word making the sugar visible.
Exactly.
So he said that most of the time it is invisible to the patient. Patient, and you talked about the same thing, that it is not visible to the patient. So once you make it visible, then definitely the change is going to happen.
And the other technology which I was seeing in a exhibition, I mean, it's not talked, but there was a paper for that. There's a transdermal. Someone is using a transdermal GLP-1.
GLP-1.
So
Yeah.
even that, we have oral semaglutide, we have injectable semaglutide, and now a trial is going on for a transdermal. I mean, just put it and you are getting it absorbed.
Yes.
So alternative routes for these peptides is also becoming a future, and probably in near future we may rid of all these injectable and everything is available to us oral. Unluckily now we are not seeing anything on oral insulin space, so no research was going on, but sure, when some other peptides will come in a transdermal format, maybe a time will come that we may
Right.
have the transdermal insulin absorption also possible.
So I think we had a very good discussion, and we could cover a lot of things. Uh, what happened during the day 2 of the ATTD at Florence, and now we will ask you to stay updated. Maybe you will be having next session tomorrow, where you will get the updates from the day 3. And till then,
So before that, before I end, for two things, I would like to invite all of you, those Indian delegates
yes,
or all the doctors across the country who are interested in field of diabetes and technology, please come for our India diabetes meeting, which is diabetes technology meeting, DTechCon. It is in Kochi from 17th to 19th of May, and where we are going to have world experts in field of diabetes and technology. They will be there for 3 days with us, and last year also it was great and grand successful. ATTD themselves also had thought of that there is a need for ATTD in Asia, and they are going to come in month of November on 18th, 19th, 20th November at ATTD Singapore. So that meeting will be also very exciting, and I'm sure those who are not in position to come all the way to Europe, they can attend that meeting in Asia also. A lot of exciting things and new things are coming in field of diabetes and technology. one very important thing which I am seeing, maybe after 10 years, a cure for type 1 diabetes we always think of. And
Yes.
JDRF have a vision that there should be a cure for type 1 diabetes. I was seeing that a stem cell therapy or creating artificial islet, there is a like line, and it will be produced like what
Cell
we are
line they are
getting
creating.
insulin. The same way islet cells will be produced and patients can be given the islet cell for cure for type 1 diabetes. So that may be the future. Maybe in another 10-20 years we may see that in reality. With these words, once again, thank you everyone, and thanks Amit, and thanks all the members or all the panelists who have come from India, because we are going to have here our Diabetes India DTech Symposia in ATTD. So I would like to thank all of them, including Jyoti Dev, Manoj Chawla, Shashank Joshi, myself, Amit, Purvi, and Dr. Rakesh Parikh. We all will be there for tomorrow meeting, and we will have few more updates tomorrow. Thank you.
Thank you. Bye. Thank you.